During this time of year, respiratory illnesses are commonly observed among Grenadians. Chief Medical Officer Dr. Sean Charles has confirmed that, so far, none of these infections originated from an unknown source. His statement comes against the backdrop of concerns raised by officials from the Caribbean Public Health Agency, CARPHA, regarding a respiratory illness of unknown origin affecting several people across the region.
We generally see an increase in number of respiratory infections around this time. Now, a number of viruses are in circulation, and in Grenada, we have identified several viruses that are in circulation and that are causing acute respiratory infections. So we've identified influenza A H1N1, we've identified influenza A H3N2, influenza B, respiratory syncytial virus, adenovirus, and parainfluenza virus. Right? These are the pathogens that we have identified that are in circulation and that are causing illnesses right now. Maybe areas or regions in the Caribbean where they have not yet confirmed which of the viruses are in circulation in their territory. But in Grenada, these are the ones that were identified here.
Despite this, he emphasized that health authorities remain vigilant, with the Ministry of Health collecting samples for testing as a precautionary measure.
The Ministry of Health, the surveillance unit in the Ministry of Health, actively monitors on a regular basis the occurrence of communicable diseases in the community. We collect samples. We test for organisms here locally. What we are not able to test for, we send to our reference lab in Trinidad at CARPHA for testing.
Dr. Charles is also urging Grenadians to be proactive by getting their flu shots, which are available to everyone free of charge.
In anticipation of the flu season every year, the Ministry of Health brings in or imports the flu vaccine, which we make available to the public at no cost. And the flu vaccine contains the antigens to the influenza viruses that are seen in circulation. So we encourage persons, especially persons who have elevated risk factor. We advise everyone to get their annual flu shot to avoid becoming seriously ill. These shots are offered at all our health facilities at no cost to the public.
Rena Thomas, GBN News.